Good afternoon. In the series of Achieving Sustainable Development Goals and Going to Moon, Mars and Beyond, we are going to discuss about SDG3 Targets and Indicators and Achieving SDG and Going to Moon, Mars and Beyond like this. Okay, so what is SDG3? Good health and well-being. That's all is about SDG3. Ensuring healthy lives and promote well-being of all at all the ages. This is part of that. And you know pandemic as however has generated health service disruptions, enlarged the investment discrepancy, increased rich country poor country disparity, and created data discrepancy which got amplified due to lockdowns. Everybody is aware. So we'll have to re-establish the 2030 SDG after the post pandemic era. Like that, we'll have to re-ensure and refurbish them. Some adjustment will have to be there. Okay, now huge disruption is there, due to pandemic. 90%, that is more than 170 countries, are reporting disruption in health services and negative impact on health. Also, life expectancy is halted or has been reversed in many countries. There is a huge discrepancy. First point is huge disruption. Second point is huge discrepancy now. Investment in universal health coverage, USC that we call, still not enough. And people are, yesterday I talked to some of the investors and they said that people are skeptical. You see the comments many places. But eventually they will come up. We know, because those who are going to invest are definitely going to invest. That is for sure, because it is humanitarian efforts. Now, third point is huge disparity. North America has 150 nurses and paramedics per 10,000, and there are 25 doctors per 10,000. Whereas in sub-Saharan region, there are only 10 health workers per 10,000 and there are 2 doctors per 10,000. And because of pandemic, there are a lot of things have been, exposed. The whole health system around the world got exposed and, teetered like anything, stretched like anything. Okay, so impact of pandemic is still unknown in till December 2021 due to lack of data and problems to collecting data due to lockdowns across the world. You just go to SDG website and goal 3 you see United Nations website. A lot of such problems they are facing. Now let us see what are the SDG3 targets and indicators. SDG 2030 needs reconsiderations, definitely I already said. Target 3.1 is to reduce maternal mortality by 70, 70 mortality per 100,000 live births. What are the indicators? 3.1.1 indicator that we call, and another is 3.1.2. First is maternal mortality ratio, and second is 3.1.2 is proportion of births attended by skilled health workers. These two are very big problems around the world. We need to work on this. Target 3.2. By 2030, neonatal mortality to be reduced to 12 by 1000, and below 5 years they should be of age, and it has to be 25 by 1000. It means it should reduce to 25 per 1000 births. Now, what are the indicators? Age under 5 mortality rate is reducing the deaths of kids under 5 years age. You see, that is what is age under 5 mortality rate. We have to provide proper medicines and healthcare so that these kids are saved from dying. Indicator 3.2.2 is neonatal mortality rate, that is reducing the deaths of newborn infants. We have to reduce that. Now, target 3.3, that is ending all the epidemics and communicable diseases by 2030. We already have faced the pandemic now. So what are the indicators? Indicator 3.3.1 is number of HIV infected per thousand. You may check. These are all formula given in the description. Indicator 3.3.2, second indicator, is number of TB incidences per thousand. Third, number of malaria incidences per thousand. Fourth, number of hepatitis B incidences per 100,000. And indicator 3.3.5 is number of needing tropical infectious diseases. Okay, so these are the five indicators for ending all the epidemics and communicable diseases by 2030, which needs correction, of course, right now. Then target 3.4, reduction of premature mortality to one third of its value by promoting preventive treatment, mental health, and well being. Okay, so what is the indicator? 3.4.1, mortality due to heart diseases, cancer, diabetes, or chronic respiratory diseases. Okay, and indicator 3.4.2 is suicide mortality rate. So we are looking at the preventive treatment, mental health, and well-being. Then how the premature deaths are happening due to diseases, cancer, diabetes, and chronic respiratory diseases. Then suicide mortality rate is also been looked at, target 3.4. Then target 3.5, strengthening all the inclusive and exclusive prevention and treatment of substance abuse. It's a long sentence, but inclusive and exclusive prevention of treatment of substance abuse is there. I hope you understand substance abuse. What is the indicator of 3.5.1? Coverage of substance abuse interventions from psychological to rehabilitation. From psychological, emotional well-being. Indicator 3.5.2 is harmful use of alcohol, that is per capita alcohol consumption within a calendar year. Whether those people are ill treated and because of that they have become alcoholic. So, what is the consumption of alcohol in that country per calendar year? That is the indicator. The next is target 3.6, reducing road accidents, including death due to, you know, because of accidents. We have to reduce it to 50% by 2020 was the target. I hope there are a lot of deaths. It goes into 300,000 in so many countries. So how can we reduce it to 150,000? Then bringing it to nil eventually if all of the people in the world follow all the road rules and regulations, they follow all the norms, and then eventually it will become nil. Okay, so indicator 3.6.1 is death rate due to road traffic injuries. So we just want to reduce it. That is the target. Then target 3.7, by 2030, ensuring universal access to reproductive health care services as integrated with national program. Now, what is the indicator? 3.7.1 is proportion of women between age 15 to 49 having access to modern safe methods. Indicators 3.7.2 is adolescent birth rate aged between 10 to 14 years age per thousand and 15 to 19 years age per thousand. It's a problem needed to be solved early to let girls and later women or ladies, what we can call them, have a better life. Women should have properly treated. Then target 3.8, achieving universal covered with all inclusive population with affordability and reach to the grassroots level. Universal Universal coverage to the medical system should be there. Indicator 3.8.1 is coverage of essential healthcare services at bottom of the pyramid. No one is left behind. Indicator 3.8.2 is proportion of large household on health per total household income. How much, I mean, they are spending on the income on the health and well-being. That is the indicator. Now target 3.9. By 2030, reducing death and illness due to air, water, and other hazardous material pollutions. What are the indicators? 3.9.1 is mortality rate to household and ambient air pollution. I hope everybody knows the Mexico City case. Everybody knows the, you know, South African city where the water was nil. Everybody knows the Delhi case where people cannot, because of smog, they cannot go to school, they cannot go to colleges. Okay, so that is they need ambient air and pollution should be reduced. So people are working hard over that. Indicator 3.9.2 mortality rate associated with unsafe wash, that is water, sanitation, hygiene, and for all services. No one should die for we are not drinking pure water if sanitation is not there. I mean, government of India, so many governments are working on it. Then indicator 3.9.3 mortality rate associated with unintentional poisoning. What is unintentional poisoning? Because of the chemicals and fertilizers, insecticides and fertilizers that have been uh, poured. In fact, I'm not saying poured literally, I mean sprayed uh, on the crops. They should reduce and we should go for organic farming. That is the suggestion over there. And okay, so unintentional poisoning is there, so that also should reduce. Then target 3.a is after 3.9. Target 3.a is strengthening World Health Organization framework convention on tobacco control everywhere, all the countries, everywhere, all possible places. Indicator 3.8.1, what is that? Age standardized prevalence, age 15 and older. In fact, it's present and its prevalence is there. In fact, tobacco consumption is harmful to health is written on so many places, even on the that pouch where it is sold, or on the cigarette smoking is injurious to health, and all those things are there, but still it happens. So how to reduce it? Governments are working on it. Then target 3.b, supporting the research and development in medicines, vaccinations, and healthcare that we saw during pandemic, in fact, and is inclusive, grassroots level, affordable, reach at the bottom of the pyramid. Grassroots level at the same time affordable at the bottom of the pyramid, with IPR taken care as per the Doha Declaration of on public health. Because many times, as you have seen during pandemic, people cannot afford the vaccination, so governments came in support and given the free vaccination. In fact, in India we already have crossed 1 billion, everybody knows that. And in India already they have achieved 1 billion polio vaccination long back, and this 2022 they have already crossed 1.2 billion vaccination, anti-corona vaccination, in fact. Okay, so IPR was taken care. If they cannot afford, then it should come at a reduced cost. If companies are willing to manufacture at lesser cost, then they have been given, the concession to buy at a lesser subsidy. What we are against subsidy, you might have seen that, but here such kind of subsidies or such kind of concessions were required. Okay, next, indicator 3.B.1, citizens vaccinated per national population. In India, population is 1.4 billion, for example. Out of them, 1.2 billion are vaccinated. So 1.2 divided by 1.4. So that is the indicator. Indicator 3.B.2, total net provided to medical research and basic health sector in that nation. In many countries, huge amount of investment is there in R&D. Out of them, some part goes to medical research as well. For example, in few countries, 7% goes to R&D. In few countries, 2% goes to R&D. Out of that 2%, 0.4% goes to medical research. Out of 7%, 0.75 goes to medical research, something like that. Okay. Then indicator 3.B.3, proportion of healthcare facilities at affordable cost on sustainable basis. So there are government hospitals in India, AIMS are there, government medical colleges are there. So where at a reduced cost, they provide you just, uh, maybe 100 cent to or 100 and 200 cent, I mean, something $1 or less than $1, people can afford, and they can afford for those facilities. It is there, still it is there, I've seen that. Indicator 3.B.3, proportion of healthcare facilities at affordable cost. Just now we saw. But affordable doesn't mean that free of cost. And free of cost or affordable cost doesn't mean that the pharmaceutical companies are not getting money, or government is not being able to afford, because people are coming forward and helping them, at for a humanitarian cause. They are coming forward and investing and donating as well, but still a lot of efforts are needed on this front. Then target 3.C, increase in healthcare worker with full professional with post recruitment facilities and benefits, especially in poor states and island states. They want to recruit doctors, paramedics, all these people with all the facilities, so that if they are taken care, they will take care of the citizens. That is the thing. Indicator 3.C.1, healthcare workers density and distribution. It should increase. For example, we saw in sub-Saharan region, only 10 by 10,000 is there. I mean, doctors are there. In developed nation like North America, 150 by 10,000 are there. So, target 3.D, strengthening the capacity of all countries for national and global health risk. We have to strengthen that, and pandemic has already proved that. Pandemic have also proved that now revisiting SDG and amalgamating them and setting them with concrete deadlines, with integrating aim to settle on moon, Mars and beyond, seems to be a valid point. Okay, so if we have a concrete plan, we will do this, we'll do that. There will be a setbacks, but still we have, if we have concrete plan, we'll be able to do that. That is for certain. We have reached at this stage. Now we'll reach at that stage as well. We didn't have aeroplanes, we have aeroplanes. We will have spacecraft to reach moon, Mars and beyond. So it will happen. So we'll have to work hard, that's all. And it should be all inclusive. Remember, it doesn't happen that only rich people will go or super leaders will go. No. A training is required, everybody knows, but it should be, all inclusive, because when you fly in a spaceship, it has an all-inclusive population. When you are traveling, suppose with at present only 10 people, 5 people can go, maybe we are taking 100 people, then it will be all-inclusive population. Okay, indicator 3.D.1, IHR, that is International Health Regulation and Preparedness for all emergencies and exigencies, is there. I mean, in many countries, yesterday we saw disaster management teams are there, like that emergency teams, exigency teams are there, uh, doctors, paramedics, and all these people, frontline soldiers are there. So how it has been done, that is the indicator. Indicator 3.D.2, percentage of infections due to some antimicrobial resistant microorganisms and other species as specified by WHO. So how many infections are there, and then that is found out, it is been taken care, and it is noted, and then standard plannings are and implementations are done. Some standards are set, then best practices are set, and then it is taken care properly next time whenever it happens. Now, finally, let us assume that we have to achieve sustainable or spiritual or humanitarian goals at it was at that time 2006 I spoke on this sentence, and then we have to go to moon, Mars, or Earth 1, Earth 2, or in this dimension or that dimension. Then to whom they will follow? I mean, the people living on the moon, whom they will follow? People living on the Mars, whom they will follow? Certainly Earthians, people living on the Earth. That is, we are the ancestors from them, and we humans on the Mother Earth, we have to walk the talk. Simple. That's all. If we walk the talk, then we'll be able to achieve Millennium Development Goals. At that time, I said that, and it is true that if we walk the talk, then we'll be able to achieve sustainable development goals, and we'll be able to reach moon, Mars, and beyond, and what not we can do. Okay, thank you. All the best to humanity.